Welcome to this brief presentation on Dyna AI, our generative AI search function in the DynaMedex platform. My name is Dr. Richard Loria. I am board certified in internal medicine as well as allergy and immunology. I am one of the physician consultants for EBSCO, publishers of DynaMedex. Given the complexities of the patients we care for, clinician workflow frequently during search of best evidence can be interrupted by the nuances or confounding variables of complex patients. Generative AI search, however, such as you will see here with Dyna AI, allows clinicians to formulate clinical questions inclusive of a patient's particular circumstances. Evidence retrieved in this manner will likely be more immediately applicable and facilitate clinician workflow. As Dyna AI only searches the already carefully curated evidence in the four walls of our DynaMedex platform, the results are not prone to hallucinations or unreliable sourcing, as can occur with platforms such as ChatGPT or Google.
Let's take a look at Dyna AI in action. One of the best ways to look at generative AI search may be to compare how a search would go in a platform that's using generative AI to conventional search. In this case, we have on the right-hand panel the Dyna AI generative AI search function, and in the left-hand panel, we have a conventional search engine. So we're going to formulate a search for what would be the best initial management for a patient with Vibrio vulnificus sepsis and allergy to quinolones. So let's go ahead and just type in Vibrio vulnificus to sort of give an even start here. But we'll start with the Vibrio vulnificus infection, and we'll ask the question of Dyna AI here on the right-hand panel. With respect to the management of Vibrio vulnificus and allergy to quinolones, we're going to go into management. We're going to go into antibiotics. We're going to do antibiotic selection and resistance, etc. And you can see now we do have in the conventional search an answer to the question, but we would indeed have to parse through this and select out for the quinolone hypersensitivity. In the example on the right, however, where we use generative AI search, we have a specific answer as to what we should not administer or administer. And here you can see with the Vibrio vulnificus sepsis and allergy to quinolones, we can administer the doxycycline along with a third-generation cephalosporin. Dosing is included. What's very important to note is that with Dyna AI, the specific citation is listed on the right-hand side, the specific chapter and verse, so to speak, with the topics from where this information has been extracted down below. The information is very rapidly acquired. We can look at another example, and we could go on ad nauseum, but for the purposes of this brief demonstration, 2 examples should probably suffice. The second question we're going to ask involves a pregnant patient with Lyme disease. What is the best therapy for a 32-year-old, 16-week pregnant woman who has erythema chronica migrans rash and symptoms of Lyme arthritis with positive Lyme serologies? So we're going to be looking at Lyme disease in a conventional search here on the left. Let's go ahead and look at Lyme, and let's ask the question of Dyna AI on the right. So here we know we're going to go into management, and we're going to go into management like clinical presentation. Now we're looking at ECM, but we're also looking at Lyme arthritis. Interesting. So we've got to look at both of these areas. And there is the issue of her being pregnant. We can go into Lyme arthritis first, or perhaps we wanted to go into ECM first. And then we would want to make sure that we're addressing the issue of pregnancy, etc. However, in the right-hand panel, Dyna AI has addressed all these issues. For a 32-year-old pregnant woman at 16 weeks with ECM and Lyme arthritis, the IDSA guidelines recommend avoiding doxycycline due to pregnancy. The preferred treatments are right here, amoxicillin, 500 milligrams orally 3 times daily, or cefuroxime Maxitil, 500 milligrams orally twice daily, both for 28 days. Once again, the specific citation or chapter and verse as to where the information is extracted from, and the topics down here below as well. Both methodologies work, but in which case is clinician workflow facilitated? clearly with the Dyna AI generative AI search function. I hope that this presentation, albeit brief, has been powerful enough to demonstrate for you the power of generative AI search. Thank you for listening.